Last week, the World Health Organization declared the current Ebola outbreak in Congo as a public health emergency of international concern, following a meeting of the International Health Regulations Emergency Committee. The Ebola virus is a viral hemorrhagic fever of humans and other primates. Signs and symptoms typically start between 2 to 3 days after contracting the virus, with a fever, sore throat, pain, and headaches. Vomiting, diarrhea, and rash usually follow, along with the decreased function of the liver and kidneys. The virus spreads through direct contact with body fluids, such as blood from infected humans or other animals. WHO said that in keeping with the international health regulations, no country should close its borders or place any restrictions on travel and trade. Acting head of epidemiology Sean Charles says they are monitoring the development.
One, you can hamper the efforts that are ongoing to control the outbreak at the source, because if these outbreaks, these measures are effective, then the risk of the disease leaving that region would be lower. So that's why that's principally why that recommendation is to, at this time, not have any of those recommendations, or you limit persons, you limit movement, or you limit trade.
The first confirmed case of Ebola was in Goma, a city of almost 2 million people on the border of Rwanda and the gateway to the rest of Congo and the world. With the onset of the carnival season and thousands expected to arrive from the diaspora, the health ministry says they remain vigilant but will not be applying any border restrictions.
There's no vaccine that is registered and approved by WHO for preventing Ebola as yet. There are vaccine trials that are going on. All right, so you cannot request persons present evidence of a vaccination when there isn't yet one. All right, and implementing these additional screening measures just for Ebola at this time, it might be unnecessary, because, like I said, the risk of the disease, leaving Congo and arriving locally is still quite low. All right, I'm not saying that there is a zero risk. I'm saying that the risk is very, very low.
The WHO is, however, advising national authorities that they should work with airlines, passenger ships, and other transport and tourism industries to ensure that they do not exceed the WHO's advice on international traffic. Eugenia Peters, GBN News.